Well, hi guys, this is Dr. Melissa Bailey. I'm a board certified orthodontist as well as the co-founder of TrayMinder. In today's video, I'm going to be addressing some questions about when orthodontics alone may not be enough to help you to achieve that beautiful, perfect smile. The first is if you have unusually small teeth in relationship to the size of your jaws. I often tell my patients it's like a bookshelf. If you have a standard size bookshelf, but the books that you have do not fill up all of the space within the bookshelf, then there will be some residual spaces that you will see. Very oftentimes, patients will notice a gap between their front teeth. That's called a diastema, and that can be exacerbated if you have a thick, low upper labial frenum. What does that mean? What is a frenum? A frenum is just a tissue attachment that attaches from the inside of your upper lip to your gum. And for some people, that attachment point is quite low, and that frenum acts like a little rubber band that stretches the front teeth apart. And so if you have that, a lot of times orthodontists may ask you to see a periodontist to get a frenectomy post-orthodontic treatment once the gap between your two front teeth has closed up. But going back to big jaws, small teeth scenario, it is difficult to manage once the orthodontic treatment is done because a lot of times that extra spacing allows the teeth to shift back into its more relaxed position and the spaces will open up. So retention, lifelong retainer wear is going to be extremely important in order to help to maintain and keep the spaces closed. But I'm talking about situations where the spacing is moderate to severe. We've seen people with larger jaws and very small teeth, and closing all of those spaces up may not be possible, and it actually may not be sustainable for the long term. It's kind of like if you had a lot of muscle mass that you had to gain or wanted to gain. Some people's biology, especially if you're an ectomorph, for instance, those are people who are naturally slender, have high metabolism, and it's difficult for them to build up muscle mass. Let's say that you did everything that you needed to do, you exercised, you consumed a lot of protein to get to that ideal physique. It's very difficult to manage or to maintain because a lot of you can attest to this, that as soon as you stop that exercise routine or you stop consuming that high number of grams of protein per day, it's very easy for your body to go back to that status quo or that normal set point. So for some people, it is very difficult to manage and keep all of the spaces closed up. So in cases like that, it may be necessary to enlarge the sizes of your front teeth. At least a lot of times people have small lateral incisors. Lateral incisors are the second incisors or the second teeth from the center. Small lateral incisors is actually a genetic thing that a lot of people have, and so if those teeth are too small, you will have to seek the help of a general dentist or a prosthodontist to enlarge them via cosmetic bonding or veneers. And not only will that make the results of your orthodontics more stable, but it's going to look better as well. So especially if you have a larger mouth, maybe when you smile it's bigger, and it just looks better if your front teeth are large enough to fill up your smile, especially if you are a bigger person or you have a broader face, a wider smile line. I think those patients can really benefit from having larger teeth. Now, the second scenario in which orthodontics alone isn't enough is similar to the first scenario. The second scenario is when you are missing teeth. Missing teeth, hypodontia or oligodontia, is a genetic condition. You know, if you have some missing adult teeth, likely it's somebody in your family also carries that same gene. The most commonly missing teeth are the wisdom teeth. Those are called the third molars. The second most common missing teeth, I believe, is either the upper lateral incisors or the lower second premolars. If you are missing some teeth, then that is a challenge to orthodontics, because you can't just close up the spaces. A lot of times patients will say, well, if you're missing a tooth, let's say on your upper right lateral incisor, then some patients will say, well, great, can you just close up the space? Well, you can, except that what's going to happen is that your two front teeth, the midlines of your two front teeth, will shift over to the side where the space is. And I know that there are fancy things that you can do, maybe some mini implants, TADs, things like that. It's just not it's not as ideal to close up spacing, especially if you're missing more than one tooth. It makes it very complicated. So in cases like that, orthodontics alone sometimes may not be the answer to that problem. In many cases, we work with other team members, such as your general dentist and maybe oral surgeons, to treatment plan dental implants that can be placed in areas where you are missing those teeth. And again, every patient has a different finding, a different scenario. So if you are missing teeth, the best thing you can do is meet with an orthodontic specialist and have that exam so that you can get some answers on what some of your options are, whether it be space closure. And yes, there are people that are missing maybe both laterals, and we are able to close up the space, and we do what's called a canine substitution, and that can be done very well, especially if you have what's called a class 2 skeletal relationship, where your upper jaw is much bigger than your lower jaw. Then in certain instances and cases, the canine substitution and closing of spaces is better perhaps than putting in dental implants. But again, every case is so different, and without an exam, without pictures and x-rays, it's very difficult to diagnose anybody's case. So the best thing to do is to get an in-person exam so that you can get examined, and the relationship of your jaws and your teeth are all being able to be visualized, and you can get your questions answered. The third scenario in which orthodontics alone may not be the answer is if you have moderate to severe jaw discrepancies. Now, I just touched upon a class 2 skeletal relationship a little bit earlier. So now I'm going to go into a little bit more about how the size and growth of your upper and lower jaws can affect your orthodontic treatment. So in an ideal situation, you have what's called a class 1 skeletal relationship. That just basically means that from the profile, from the side, the growth of your upper jaw here, the maxilla, and the growth of your lower jaw right here, the mandible, they are growing proportional to each other. And when that happens, when your jaws, when your lower jaw grows downward and forward harmoniously with your upper jaw, then more than likely your teeth and your bite will be also in a class 1 relationship. Your teeth will just naturally fit together in sort of a gear type pattern. So I always tell my patients, your teeth have peaks and valleys, and if your jaws grow harmoniously, if your jaws are well proportioned, your teeth will just come together like gears like this, top and bottom. Now, it's not uncommon for people to have class 2 skeletal relationship. That just basically means that in relationship to your top jaw, the lower jaw is small. So For a lot of patients, they usually will say, well, my front teeth are sticking out too much. It's usually because your upper jaw grew forward too much and your lower jaw did not grow enough, or some combination of that. Maybe your lower jaw is normal, but your upper jaw grew too much. Or maybe more commonly, your upper jaw is just right, but you had undergrowth of your lower jaw. You have a recessive or a retrognathic mandible is what we call it. Your lower jaw did not grow forward enough. And so you have what's called a convex profile. And so accordingly, if your lower jaw did not grow forward enough, then your lower teeth are going to be more set back in relationship to the upper jaw. In most cases, I say that it is the undergrowth or retrognathic mandible. Lower jaw is too small. Most of the time, most people's upper jaws are in sort of more ideal position, unless you have what's called mid-phase deficiency in some class 3 cases. So on the other end of the spectrum, of course, you have class 3. Class 3 is where the lower jaw, it's also called underbite or anterior crossbite. It just means that your lower jaw is too far forward in relationship to the upper jaw. And it could be a combination of too little growth of the upper jaw, normal lower jaw, or normal upper jaw and too much growth of the lower jaw, or a combination of too little growth of the upper jaw forward and too much growth of the lower jaw forward. Anyway, I hope you caught all of that. It sounds a little crazy, but basically it just means that the lower jaw is too far forward in relationship to the upper jaw. So that's why, you can kind of see that bulldog sort of look where the lower jaw and the lower teeth are in front of the upper teeth. Okay, so in cases like that, in mild cases, we can camouflage it with just orthodontics alone. Okay, in your garden variety cases, we could manage it by having our patients wear some rubber bands so that we can kind of shift the teeth around. Now, there's a lot of questions from my patients about how do you fix a bite? Like, do you actually move the jaws, or how does that happen? And so I'll do another video on that later, but basically just quickly, how you can kind of think about that is think about two buses. You have two big buses and you have people that are sitting in the seats within the bus, right? So imagine you have one bus, which is your upper jaw, and you have your other bus, which is your lower jaw. Now, orthodontically, I cannot, if I'm trying to coordinate the buses, I am not, as a person, I am not strong enough to push the bus, either bus. I just can't. I can't move the bus. The bus is like your jaw, okay? I cannot move your jaw. Your jaw is set. I mean, there are cases where if you're a child, we can do some dental-facial orthopedic stuff. I'm not talking about that. I'm talking about where you're already a teenager or above. Your jaws are pretty set. I cannot move it, just like I can't move the bus. However, there are seats within the bus and there are people inside of the buses, right? So the people, they represent the teeth, right? So if, let's say that bus A, your upper jaw, the people are sitting in the very first seat, right? And then in the second bus, maybe the people are sitting on the third row, and you feel like, oh gosh, bus A, the upper jaw, the people are sitting too far forward in relationship to the second bus. What you can do is you can just tell the people, hey, row 1, can you just move to row 2 so that you're more coordinated with the row 3 on the second bus? So you can move the people around within the seats, okay? But you cannot move the bus. So that's kind of how I explain it to my patients, right? I can't change your jaws. Your jaws are set, okay? But I can move some of the teeth within the jaws. Okay, so that's where rubber bands come in. Rubber bands, they move your teeth. Okay, so it's kind of like, I can move your teeth to a certain degree, but just like in a bus, I can't move somebody where there isn't a seat. I can't move them so far forward that there are no seats for them to sit in. So I have to, orthodontically, I have to move the teeth within the boundaries of where you have bone. You cannot move teeth outside of the bone of support, because you'll lose your teeth or there will be severe gum recession. So it's not possible to do that. So that's why when we're fixing the bite, there is a limit to how much your orthodontist can actually fix your bite, because we're limited by where your bone is and how much bone there is. So there's a limit, okay? So in mild cases, we can fix that. In moderate cases, if you have moderate jaw discrepancy, what we would do is we would do camouflage orthodontics. Camouflage orthodontics is where we would extract teeth either on the top or on the bottom in order to use the extraction space to move your teeth in the direction to help to camouflage the fact that you have a jaw discrepancy. So you're compromising the teeth to some degree because you can move the teeth to a certain degree, but you can't move the jaws. So you camouflage the fact that you have a jaw discrepancy by moving teeth around. So a common example would be if you had a class 2 where your top teeth are sticking out a lot further than your bottom teeth, and so sometimes your orthodontist may opt to take out 2 premolars, extract 2 premolars so that there's room to back up your top front teeth back to meet the smaller lower jaw and the lower teeth, right? You can't make the lower jaw bigger, right? So your lower teeth are already set back. So all you can do is take out some teeth so that you can back up those front teeth. You make the bigger arch smaller to fit the smaller lower arch, okay? So sometimes we do that. Sometimes we do IPR, which is called interproximal reduction. Interproximal reduction basically means that we slenderize some of the teeth so that they take up less room so that we can retract them, okay? So we've covered the mild and the moderate. Now, in some cases, patients have very severe discrepancies in the sizes of their jaws, or maybe even shape. You know, some people have asymmetry of their lower jaws or upper jaws, in which case, to get that ideal bite and aesthetics, surgical orthodontics may be considered. What does that mean? Surgical orthodontics just means that you have orthodontic treatment, but you also need the help of an oral and maxillofacial surgeon to do orthodontic jaw surgery in order to make a jaw bigger or smaller so that the jaws are more proportionate with each other and the teeth and the bite can come together properly. So that is a case where orthodontics alone is not enough to give you that ideal bite and ideal aesthetics. The last scenario that I can think of where orthodontics alone is not enough is if you have periodontal disease. Periodontal disease is when you have a decreasing amount of bone that is supporting the roots of your teeth. Periodontal disease is basically a condition, it's the other condition besides cavities or besides decay that causes people to lose their teeth. You know, most people think about losing teeth if they get a big cavity or they have an infection, root canal fail, and teeth need to be taken out. Periodontal disease is kind of like that silent disease where it's usually not painful and you're losing the level of bone, and over time there's not enough bone support to hold the roots of your teeth, and then your teeth can fall out. Now, periodontal disease is an active periodontal disease is a contraindication for orthodontic treatment, because moving teeth when there is inadequate support can exacerbate that progression of bone loss, and you can lose teeth if you are undergoing orthodontic treatment. So orthodontists are quite, if you are an adult, for most of my patients, I will require a cavity clearance in addition to periodontal clearance, so that we can assess the health and condition of your gums and bones, so that we can ensure that you're healthy enough, your teeth are healthy enough to undergo orthodontic treatment. It's very similar to perhaps when you played sports in high school or in college. You may need to get a physical from your physician in order to clear you for your participation in sports. It's similar to that. We want to make sure that your teeth the foundation of your teeth are healthy and strong before we allow you to pursue orthodontic treatment. So if you have active periodontal problems, it's very important to see your general dentist or even a periodontal specialist, a gum specialist, who can help you to manage those problems and get you to a healthy state so that you can pursue orthodontics. So there you have it. Those are the big four scenarios in which orthodontics alone may not be enough. And those are, number one, big jaw, small teeth, missing teeth, jaw discrepancies, and underlying periodontal disease. Well, this has been a really long video. If you've made it to the end, I'm really happy that you did. Thank you for watching. I hope that you have found this video to be helpful, and if you like it, I would appreciate it if you would give it a thumbs up. Subscribe to the TrayMinder channel so that you'll continue to get more helpful videos. And this is Dr. Melissa Bailey. I'll see you next time. Bye.